Have you ever felt like medicine just isn't working the way it should? Sometimes bacteria develop special defenses called ESBL. ESBL stands for extended spectrum Beta-Lactamase. This enzyme is present in certain bacterial strains that is harder to be treated. Many of the antibiotics used to treat infections, such as penicillin and cephalosporin, are ineffective against the bacteria to produce ESBLs. The bacteria could be exposed to the many antibiotics for a really long time that it creates immunity against resistance towards them. An ESBL bacteria can chemically break down and destroy its target antibiotic, making it useless against an infection. Beta-lactam antibiotics or cephalosporin are divided into 4 generations based on the range of antibiotic activity they possess. Most of the activity in the first generation is gram-positive with less action against gram-positive bacteria. The second and third generation are more active against gram-negative bacteria. The range of activity for cephalosporin in the fourth generation is extensive. ESBL contains 4 bacteria that will produce these strains such as E. coli, Klebsiella pneumonia, Klebsiella obstetrica, and also Proteus mirabilis. For confirmation tests, we will use 5 specific antibiotics, which are ceftazidime, cefotaxime, ceftazidime with clavulanic acid, cefotaxime with clavulanic acid, and also cefoxitin. So we use cefoxitin or FOX30 as to differ between ESBL and also MX strain. So how do we interpret the result? The result obtained after an overnight incubation at incubator O2 for 37 degrees Celsius. This ESBL positive shows a keyhole shape at a Wheeler-Hinton EVA, presents a resistance to antibiotic use. Other indicator is that the zone of inhibition of the antibiotic use with clavulanic acid should be more than 5 mm than its original antibiotics. In opposite, ESBL negative shows no keyhole or resistance to antibiotic use except for cefoxitin. So how do we inform the result? We will contact the requester of the ward or directly inform the doctor in charge of the patient. So, the doctor will usually ask to isolate the patient from others to prevent the spread of infection. Because this ESBL bacteria can be spread through a contact with a patient. So, what can we do? By choosing antibiotic wisely is a key. Only use them when prescribed. By understanding ESBL, we can all be part of the fight against antibiotic resistance.